Postoperative varus alignment of an unstable subtrochanteric femur fracture treated with an intermedullary nail has been shown to be related to which of the following factors? 1. Use of a piriformis entry nail through a greater trochanteric entry portal. 2. Use of a greater trochanteric entry nail through a piriformis entry portal. Number 3. Use of a lateral entry nail through a piriformis entry portal. Number 4. Use of a femoral distractor device to obtain a reduction. Number 5. Use of a fracture table to obtain reduction. And the answer is 1. Use of piriformis entry nail through a greater trochanteric entry portal. I will give the reason. The reason is the usage of a piriformis straight nail through a greater trochanteric entry portal will bring the fracture into varus, as the greater trochanteric entry site's axis is lateral to the femoral shaft, and advancement of the nail causes the two axes to become collinear, leading to varus. More regarding a subtrochanteric fracture. Subtrochanteric ST femur fracture are defined as fracture of the proximal femur that occur within 5 cm of the lesser trochanter. Multiple deforming forces act on both of the proximal and distal fragments of the fracture to create a characteristic deformity. On the proximal fragment, the gluteus medius and gluteus minimus causes abduction, ellipsos causes flexion, and the short external rotators, that is the piriformis, obturator internus, quadratus femoris, and the superior and inferior gemelli causes external rotation. On the distal fragment, the gracilis and adductor muscle cause an adduction and shortening force. The characteristic deformity, abduction, external rotation, and flexion of the proximal segment and adduction of the distal segment is a typical fracture pattern of varus and procurvatum. This picture illustrates the deforming forces, the red arrow of the proximal and distal fragments in the coronal planes. The proximal fragments is abducted by the gluteus medius and minimus 1, flexed by the ellipsos 2, and externally rotated by the short external rotators 3. In a coronal plane, in the next picture, B is sagittal plane, the distal fragment is adducted and shortened by the adductors and gracilis. Entry to the piriformis fossa. The main advantage is a collinear trajectory with the long axis of the femoral shaft. Entrance portal anterior to the midpoint of the trochanter may result in perforation of the anterior cortex of the proximal femur. Entry that is too far anterior results in deformation of the nail and comminution of the proximal fragment. Entry that is too far medial may result in femoral neck fracture. For nails are designed for the piriformis entry, the lateral placement through the trochanter may cause varus alignment of the proximal fracture. So, the answer for our question just now, entry in the posterior aspects of the piriformis fossa generates least stress in femur. Such placement ensure that the hole will be aligned with longitudinal axis of medullary canal in both sagittal and coronal plane. Excessive medial placement may create an stress riser in femoral neck. It may also compromise the vascularity of the femoral head. Disadvantage of entry through the piriformis fossa is peritrochanteric pain. A report by Dora et al. Cadaveric study. This study shows that with entry portal, A. Lateral to the junction of the neck and the greater trochanter, there will be a partial avulsion of the piriformis and the obturator internus tendon. For B, entry portal at the base of greater trochanter anterior to align along the longitudinal axis of the femoral neck will cause injuries to the piriformis tendon and to the gluteus minimus tendon. C. Entry portal at the base of greater trochanter but posterior, currently posterior, to align along the axis of the femoral neck at the piriformis fossa will cause a partial avulsion of the piriformis, obturator internus, obturator externus with anterior branches of the ramus profundus of the medial circumflex femoral artery MCFA within the synovial fold will be damaged. The result of this cadaveric study favor the nail entry portal lateral at the greater trochanter.